Okay, so what we're going to do today is goniometry of shoulder abduction. Okay, so your landmarks for this are going to be the anterior acromion, okay, the front of the acromion. So we've talked about how to find that. You can come up the spine of the scapula, come around, and then just go to the very front of the top of it, and that's your acromion. You're going to put your fulcrum there, right? And I'm going to show you how you have to adjust that for some patients, okay? And then the distal arm is going to be lined up with just the midline of the torso, right? So right in the middle, basically you want to be parallel to the sternum, okay? And then finally, the last one is going to be right in the middle of the humerus, okay? So because with some patients they have a big chest, and that's not just women, actually. You will get kind of barrel chested men as well. You're not going to be able to set this on there and get your landmarks properly, so you have to find it, and then you can use this little see-through hole right there and line it up where that point is, which I've done. The other thing you might want to do is have them, we want their thumb up here, and you want to have them kind of bring their arm out a little bit to start so that it's out of the way, okay? So Karen, the action I'm going to have you do is to bring your arm up and over your head, okay?
Like that?
No, just straight up,
okay.
Like that, okay? So I'm going to have you leave it right here. I'm going to find my landmarks again. Good. I'm going to leave the distal arm midline, and I'm going to have you raise your arm up and through all the way like you did. Good. And I'm going to put it mid-humerus, and she's at 180 degrees, and I've stayed kind of up off of her body because of just, you know, patient discretion, you know. And so she's at 180. If I needed to go further and test her further, you just kind of grab on and push as you move the goniometer. And that's how you do goniometry for shoulder abduction.